Thank you for tuning in to Teaching for the Culture. This is your host, Bianca Goolsby, and I'm so excited to be with you today. I have the phenomenal school board member, Karen Perez, who is in a countywide seat in Hillsborough County. How are you, board member Karen Perez?
I'm doing good, thanks. I am.
Good, good. Well, so I have seen that you have made the news recently because you recently received your COVID-19 vaccine. And I definitely wanted to kind of hear you out about your journey and to learn about your process and educating the community about your experience.
Thank you. I did. Aside from sitting on the board as a board member for Hillsborough County Schools, I work for the Tampa VA as a social worker. And so I had the incredible opportunity to receive my first vaccine. Of course, I'm not sure if the public knows that there's two, you receive two vaccines, 21 days apart from each other. So I received my first vaccine, and the first vaccine ended up being almost like getting your flu shot.
Mhm.
I know some people react, some people don't. So I wanted to kind of be um, transparent with the community because I know I'm probably one of the first ones that the community knows of that has received the COVID shot that's in public office. So I received the shot on Wednesday morning of last week. And about an hour after I received the shot, I got a really intense headache. And then my arm was really hurting. I could barely like lift my left arm.
Wow.
Yeah, and then it started hurting across my back, across my shoulders. I received my shot at 8 o'clock in the morning, and by 1 o'clock, my whole body was hurting. But to be very transparent with the community, I do have celiac disease. So um, that celiac disease also, um, when a person has celiac disease, they have an immune deficiency. So I have an immune deficiency. One of the reasons why I wanted to talk to the community about me having received this vaccine. So I'm not sure if that's the reason why the vaccine. I ended up having such a response to the first vaccine, and the next day. Well, let me take you to the first day. So by evening, my body was still in a lot of pain. Went to bed, took some Tylenol several times in that day, went to bed. The next day, I still had a bit of a headache. Um, like when you have a real intense headache, the next day you have like a fog headache. Um, the next day, I still have that fog headache, but my body still hurt. And I noticed for Christmas, I was really tired. Um, you know, extremely so tired. But I want to say by Sunday, I had a lot more of my energy back.
Good.
Hmm.
So far, you've kind of explained how you've been experiencing kind of like the roller coasters of, the after effects. Like, what are some of the things that you're doing to kind of like keep you elevated and to keep you upbeat when you're going through the roller coaster of that vaccine?
Well, I'm making sure, I've always been very healthy. I've been a very healthy eater, always very self aware of making sure that I exercise, prior to this vaccine. So, so I've made sure that I've maintained that schedule. You know, I do yoga in the morning, my meditation, make sure that I eat healthy. But during the last few days, I just noticed a decrease in appetite. So I had to make sure that I ate something. I had to make sure that I was aware, of even though I was tired, to get up and make sure that, I fed, my body. um, and made sure that I drank plenty of liquids, hydrated really well. And, so I'm not sure if that helped, but, that's the schedule that I maintained.
Absolutely. And what are some of the things that you would want to share with the community about your journey so far? And for the people who are, have their own opinions of the vaccine, what do you want to share with them?
Well, one of the reasons why I've been so public about the vaccine is the first injection. I know that it gives you like flu-like symptoms, but the second one is supposed to really take you down. It's supposed to be even more. It's supposed to be stronger than the first vaccine. Um, so one of the reasons why I've been so vocal and very public about my taking of the vaccine is because COVID is taking down a lot of the Black and Hispanic community.
Hmm.
And protecting ourselves should be first and foremost for us. So when this vaccine becomes available to the public, that our Black and Hispanic communities make sure that they take this vaccine. So I'm putting myself out there so that our Hispanic and Black community see um, that I'm taking the vaccine, the effects that it's having on me, especially with my underlying health issues, so that they're not afraid to take this vaccine. I know that in the Black and Hispanic communities, there's a lot of diabetes, a lot of hypertension, a lot of heart issues, a lot of overweight issues. And so these are factors that COVID-19 really attacks. And, in order for us to be around, in order for us to make an impact in our generations, we need to make sure that we protect ourselves. And in protecting ourselves against this virus, it's going to be by taking this vaccine.
Absolutely. Well, I just thank you so much for just taking moments out of your day to kind of explain to the community what's going on. And I see that you've been doing Facebook Lives to keep people updated. So I will make sure that I link your profile. So if people don't know that you're doing these Facebook Lives, now they know, so that they can stay up to date with what you're doing. And just thank you so much for what you're doing in the community always. And I want to give you the floor for any closing words that you want to say to the community.
Thank you. Um, our community has always looked at the issue of injections. I know that um, when it comes to the Black and Hispanic communities, society has always used us as experimental um, cultures. They've always experimented with us. But when it comes to COVID-19, I think we need to protect ourselves against this virus that is attacking our communities. And we don't want to end up being the community that does not educate ourselves well in protecting ourselves. And um, I'm going to be the one who's going to put myself out there in the forefront. I'm not going to ask you to do something that I'm not going to do myself. And that's the reason why I'm so public about what I'm doing. I know the second vaccine is going to be a lot more. Um, it's going to be heavy, with its effects.
Hmm.
But I'm going to be public with that one too, and transparent. And I believe when our community sees, the effects, you'll be able to prepare yourself. Families will be able to know how to take care of each other.
Mhm.
And this is important. This is important for us. We have, generations that right now are relying on our survival in order to make it. And our survival is not 6 feet underground. So, I implore you to, follow me, see how I do, and take this um, virus very serious. And, look and research at the vaccine to make sure that you protect yourself and your families.
Well, I just thank you again. And folks, please wear your mask. Please practice social distancing. COVID-19 is a real thing. I will definitely link your Facebook so that people can connect with you. And thank y'all for tuning in to Teaching for the Culture. Have a great day.